In 2017, I made a career commitment to becoming an interventional radiologist. What I didn't know was mid-journey, 2 years later, I would endure something life-changing, making it clear to me that following through with this career commitment would mean more than anything to me than ever. And no matter how much blood, sweat, and tears were put in, I needed to get to this goal. In July of 2019, I received a phone call, like any other ordinary day, from my friend Autumn, who was age of 19. She was getting ready to head into work, but was complaining of a severe migraine. She later called me while eating her lunch, just telling me how she didn't feel right. Her headache was more severe than other days, and her vision was impaired. I told her to maybe see if she could leave work and get some rest. Little did I know that would be the last time I spoke to her. I later received a call from her family that she had passed away from a blood clot that traveled not only to her lungs, but also her brain. This is something so hard to comprehend, to believe, and to come to terms with. I started researching what I could do or what I should have done or known that could have potentially saved my friend's life. This is when I came across Stop the Clot Foundation. Blood clots on average lead to a death every 6 minutes. The more people I can make aware of the leading causes, signs, and symptoms could potentially be that one more life saved. More than half of my viewers will know, have known, or will have been through one of the leading causes. Some of the leading causes are car accidents or any trauma, birth control, which every female is on at some point for many more reasons than just preventing pregnancy. Sitting in a chair for long periods of time, especially with your legs crossed, any form of surgery or hospitalization, which is so common nowadays to have at least once in your lifetime. Smoking, diabetes, pregnancy, obesity, also all causes. The symptoms of blood clots could be swelling or discoloration of your skin, chest pain, irregular heartbeat, difficulty breathing, blurred vision, and severe headaches. The most common type of blood clot is a DVT, which is known as deep vein thrombosis, which is located deep within a vein, usually in a leg or arm, and up to 30% of people will die within a month of a DVT diagnosis. You could also have a PE, which is a pulmonary embolism. This is a blood clot that traveled from deep veins to your lungs. Sudden death is one of the first symptoms in 25% of these cases. You can also suffer a blood clot to the brain, which is known as a stroke. You can even also get a blood clot to your heart. Early diagnoses are critical to prevent death. They can happen to anyone, anytime, any age, but they can be prevented if you are at risk. And about 33% of these people will have another blood clot within 10 years. Preventing a blood clot can be as easy as changing your position often, especially during a long flight or car ride, staying active, ask your doctor what type of exercises are personally best for you, taking medications prescribed properly, eating less salt, try to avoid trauma to your legs as best as possible. If you have a job that insists on being on your feet for long periods of time, you might want to invest in a good pair of compression socks. Now, how can you help, you ask? First, you should learn the risk. Know the signs, the symptoms, the causes. Follow a social media page, or all of them, to spread a campaign. Join the team Stop the Clot on their webpage. Fundraise. You can join the 5K run, golf tournament, or kickball tournament that they hold yearly. Most importantly, spread the word in hopes of stopping a clot. I will also attach charts and Stop the Clot Foundation below. We never think this could happen to us or someone we love until it happens. Knowing the signs and supporting the cause will lessen the chance of you or a loved one going through the same heartbreak and shock that I did. So please help me and raise awareness and support the people who have already lost to blood clots and join Stop the Clot on a never-ending battle.
Some of the early signs.
What are some of the signs?
Early signs.
Swelling, headaches, but you would know because you've been in the hospital. You would have had a prior blood clot or surgery, something.
Can you tell us how the foundation actually works and what they do for the patient with blood clots?
The purpose of the foundation is to advance the prevention of early diagnostics. And also, as well, they support successful treatments, and they also want to go about early diagnostics.
Why are you so passionate about this foundation?
At first, I just wanted to be working in a cath lab, and then it became more clear to me when I lost my best friend to a blood clot that I wanted to specifically train on blood clots.
Thank you.
Thank you.
Thank you.
Yeah, okay.